The year is 2022, and according to mentalhealthamerica.org, mental illnesses and diagnoses affect just under 20% of adults in the US. That's 50 million individuals. Neurological music therapy offers a unique solution to individuals with mental diagnoses that can be conjoined with pharmacological treatment and counseling to provide benefits across multiple domains to your patient or client. But before you grab your guitar or your egg shakers, you might want to think about what counseling approach is best for you. The term counseling and the actual practice of theoretically based psychotherapy can be traced all the way back to the Middle East during the 9th century. While dozens of pseudoscientific ideas and methods have since then been disproven and rejected by the scientific community, counseling approaches such as behaviorism and later cognitive behavioral therapy emerged in the first half of the 20th century. Approaches? Cognitive behavioral therapy? You might be thinking, what does all of this have to do with music therapy? Counseling approaches present concepts regarding client-therapist relationships and procedures over the course of treatment that can be tailored for use by music therapy students like you. Each counseling technique is different, and oftentimes you'll want to have some sort of combination between two or more techniques. In this video, we're going to be talking about CBT and RBT and analyzing its effectiveness in the case of Stan. Cognitive behavioral therapy, or CBT, involves a collaborative relationship between the therapist and the client that recognizes how personal distress can be attributed to disturbances in the client's cognitive process. Furthermore, CBT holds that changing an individual's cognitions can produce a change in behavior that is favorable for the client. CBT tends to operate on a shorter time schedule of around 12 to 16 weeks. Cognitive behavioral therapy offers the therapist the role of the teacher while the client holds the position of the learner. Rational emotive behavioral therapy, REBT or RET, marked the beginning of cognitive behavioral therapy. The premise of REBT is that an individual's strict beliefs and idealities about events and situations contribute to their own psychological issues. REBT holds that cognition, emotions, and behaviors interact and have strong relationships between each other. The ABC framework of REBT is essential to understanding its effectiveness. The model is a tool for the therapist used to understand the client's feelings, thoughts, and behaviors, and it works something like this. A represents the activating event occurring to a client. B represents a belief held by the client. And finally, C represents the emotional and behavioral consequences of the client's belief. REBT inserts itself at B, or the client's belief phase of the framework. At point B, the client's previously held belief, D, appears to represent the disrupting intervention that supplements the client's self-destructive thinking with rational thinking. D then leads to E, or the effect of the disrupting intervention. Finally, the process ends at F, or the new feeling created by the rational beliefs learned from the client's participation in REBT. The view of human nature through the lens of REBT shows that individuals hold the ability to think rationally and irrationally. Furthermore, humans are the progenitor of their own self-destruction, self-blame, and procrastinations. Goals within the therapeutic process of REBT include leading the client towards minimizing their self-harming behaviors by learning more realistic philosophies of life. The educator role that the therapist takes on is meant to show the client the difference between realistic and unrealistic goals. The hypothetical case of Stan allows us to practice counseling techniques before using them in a session. To get an idea of what CBT and REBT might look like in action, let's imagine that we're going to plan a treatment for Stan with those techniques in mind. Based on what we know about Stan's behavior, he presents himself defensively, relies heavily on alcohol, has a poor sleep schedule, and avoids social situations with others. In the emotional domain, Stan experiences anxiety, depression, feelings of loneliness, and a lack of self-worth. One way we could approach this client is by asking them what specific areas they would like to see change in. We can follow up by explaining to Stan that therapy sessions can help him reach these desired goals. When Stan says that he would like to get rid of his inferiority complex, we can respond with questions such as, describe what you're referring to when you mention an inferiority complex, and explain a scenario where you feel inferior. One of Stan's goals is to return to normal daily function without the use of alcohol or drugs. We can suggest journaling to keep a record of when and where he decides to drink. Instead of focusing on what behavior Stan would like to get rid of, we can focus on what skills he could develop or grow. When Stan says that he would like to reduce his feelings of apologetic existence, we can recommend modeling and role-playing. For example, we can assume the role of his boss at work and allow him to practice confident and direct behaviors. We can then provide feedback on how strong or apologetic he presented to us. How else can we work with Stan to improve his confidence? Well, we can utilize imaginal exposure and desensitization. First, Stan learns relaxation procedures during therapy sessions and practices them at home, which sounds like a really good time to introduce progressive muscle relaxation or music relaxation if you're a music therapist. Then, he can create a list of his specific fears when it comes to failure. Stan highlights his fear of dating and talking to women. He recognizes that he feels the least fearful when he's interacting with female peers that he does not feel attracted to. We can begin by recommending Stan to increase his interactions with his female platonic peers. Gradually, we will progress up and up his fear hierarchy as his fears become more and more mild. The goal for therapy for Stan is to modify his unrealistic thoughts, which in turn lead to self-destructive behavior. He can learn coping strategies, reduce unrealistic thoughts, and create more realistic and positive responses to stressful situations. At the end of the day, we want to help increase Stan's satisfaction with his own life. So now, you're ready to keep practicing RBT. Try it out in your next practicum session and see if RBT is right for you and your client. That's going to wrap up today's video. Thanks for watching.